Today's conversation: overcoming the burden of disease.
Thanks, Marshall. As Marshall says, I'm a graduate of the University of the West Indies. I had the privilege to live and work in many of the islands in the 90s, early 2000s. My current role is as a Director of Public Health, and in some of the discussions, particularly in the UK, you will have heard about the role of the National Health Service in terms of treating patients and many of the other things that the NHS does very well. The role of Public Health England as the national body for public health. But in between are the role of local government, local councils, and a lot of the day-to-day response at a local level and the mediation with local communities has been with local government. And I think that certainly the role of the local director of public health was one that hadn't been recognized sufficiently early in dealing with this pandemic. And just picking up on some of what you've heard earlier, every outbreak starts fundamentally as a local issue. Whenever you trace, if you think about HIV, if you think about H1N1, if you think about the current pandemic, it always starts as a local outbreak. And your ability to get on top of it early is directly proportional to how much resilience your local systems have in place to identify threats early and to manage them early. We have pandemics because fundamentally local public health systems have failed. And that's one of the lessons that I hope we will learn from this pandemic, that in addition to the national infrastructure that you need to have in place, you also need to have strong public health local systems that are able to recognize and respond to threats whenever they arise. I have spent the last year mostly in North Yorkshire, which is the largest county in England by geography. Largely an affluent area. And so my perspective of dealing with COVID was in a rural setting across a very large geography. And there are some insights in dealing with it at that level that may be very different to some of the issues that we saw in some of our cities. Since about the last 3 months, I have been in the southwest, in Torbay. Torbay is called the English Riviera. It is a tourist destination. We learned this week that TripAdvisor is saying that we're the #1 destination for the UK, and we are all gearing up for when the visitors join us in force over summer. It is a truly beautiful part of the world and close to the sea once again. Within 15-20 minutes walk down to the seaside, which is good. This part of my career, having been away from the sea for such a long time, it is good to have this opportunity. I wanted to share a few of my own reflections coming out of the last year. And it's interesting that some of the data we've looked at and some of the whole discussion in the UK and the US is framed in terms of the experience of Black and Asian minorities in these countries. I have to remind myself, and I remind others, that the UK and the US is not the world, and that in actual fact, there are many, many countries, including the countries of the Caribbean, where Black leadership has been in charge of leading majority Black populations through the pandemic. And I think it's useful when we reflect, and I agree with others, that we will not learn the lessons of COVID fully for probably another year. This is a global pandemic. It is playing out in different countries at different times. But early on, we can begin to see that there are some examples of good practice. And I have to say, I have been proud, and I continue to be proud of the track record of Caribbean governments in managing the pandemic thus far. Don't underestimate, and I know many of you are going through particular pressures now, and you feel that things could have been better, and I'm sure there will be lessons learned. But you have been in the Caribbean in the shadow of the United States, which, given all the travel and economic links, consider the efforts that have been made to prevent the disease from seeding and from having an even greater impact on Caribbean governments and Caribbean islands and territories. And I think that we have done some things well as majority Black and Asian populations, and they're examples of good practice that will give us some hope as we go into this next phase. Having worked for much of my career in public health in the UK in areas that have been predominantly white, certainly not high percentages, most of them have been less than 2 or 3% ethnic minority makeup. I am struck by the fact that most of the white population in the UK do not understand this history of slavery. Some people may have been exposed to it on a certain level. They may have gotten it through television. 12 Years a Slave certainly raised people's consciousness in the last year, the Black Lives Matter, George Floyd. But for a lot of people, in a lot of ordinary people living their lives, just don't get why this black-white thing is a factor. And you got to understand that when we try to find ways forward, because we live this, we feel this history. It is something that is inescapable for us. And we assume, therefore, that other people get it like we do. And I think that there is something about understanding that some of this knowledge that we hold is not just for us as people with Black heritage and people who have felt the impact of slavery and its ongoing impact, but also to understand that the people we live with and around may not get it in quite the way that we do, and a certain amount of patience and sharing that history is important so that people understand where you are getting. And I think the George Floyd, that murder, galvanized, because suddenly a lot of white people got up, and some of them have said that to me, and suddenly said, we begin to get the issue. We begin to understand the anger. We begin to understand what's been happening. And I think that there's some good sharing of interest there that we can use as we go forward. One of the things that I've picked up, and certainly in terms of how do we respond to a higher level of Black and ethnic minority impact of COVID, was a sense in which people, from what they perceive to be altruistic methods or altruistic desires, fall into the same trap that they've always fallen into. And it is the trap of wanting to solve somebody else's problem for them. And I've been in a lot of situations where I've had to say to people, yes, I understand that you want to do something good and you want to act in the best interest of others, but actually what you're proposing is going to make matters worse. And there are lots of things and the rhetoric about what we needed to do to address COVID in some of the ethnic minority communities that came across as totally tone deaf and has caused a lot of problems. It is no surprise, I think, that a lot of people have been very suspicious in some of our Black communities of authority. They've been very suspicious of the efforts that people are making, I think genuinely, to try and make things better, because many people just don't understand how you will see things. So, many people didn't understand about the Tuskegee experiments in the United States and how that would play into a narrative that says, let us prioritize people in Black communities to have the vaccine first. That prioritization is done out of good intentions. But if you don't understand history and context, you don't understand why some people will say, you're wanting to experiment on me. And so I think those are some of the issues that we need to consider as we find ways mutually, both Black and white together in communities where we need to live side by side, of finding ways to build a better society and communities as we go forward. And the final points I want to make are the need to find common ground with people who are poor. So my background working in predominantly white areas is that, and largely affluent areas, I have to say, if you look at the statistics, is that very often the poor are neglected. And when you talk to a poor person who may be white, working class, a lot of the issues of alienation and mistrust of authority and all the rest of it are very similar to what you may find in Black communities. The context behind poverty and the perpetuation of poverty may be very different, but the day-to-day lived experience offers some commonality. And I have found, for example, that trying to have discussions about how you deal with long-term joblessness in some white communities was more difficult, because some people were tending to look at this as a failing of individuals. We've seen a lot of the stuff in the UK about the welfare state and welfare scroungers and the way that we talk about people who are on benefits. Now that a lot of people have lost jobs or found that their jobs are insecure because of COVID, suddenly people get it on an emotional level that you could find yourself in economic dire straits, not because you were lazy or you didn't plan ahead, but simply because you are in a context of where the system is working against your best effort. And we've found lots of evidence that says poor people in general work harder, they are as diligent as any, but the system is not set up necessarily to reward that. And so there are lots of issues that we will need to think together in terms of the next stages as we move out of the response and create, hopefully, societies that are more resilient to pandemics and that learn these lessons of if we do not look after the socioeconomic factors, if we do not understand the underlying health risks that people face, then we're going to be hugely vulnerable for any threat that may arise, such as another pandemic, should we unfortunately have one.